In this podcast episode, neurologist Dr. David Perlmutter shares critical insights into Alzheimer's disease, emphasizing that the roots of this debilitating condition often begin in our 30s and 40s. He discusses various factors contributing to the rising prevalence of Alzheimer's, the role of metabolism, and the importance of lifestyle choices in mitigating risks. Dr. Perlmutter opens the discussion by highlighting the staggering statistics surrounding Alzheimer's disease in America. Currently, nearly 7 million Americans are living with Alzheimer's, and projections suggest that this number could rise to 1 to 7 million by 2050 if no medical breakthroughs occur. This alarming trend is not solely due to an aging population. The rate of increase in Alzheimer's cases far exceeds what would be expected from demographic changes alone. Dr. Perlmutter emphasizes that this indicates a deeper underlying issue that is not genetic, but rather linked to lifestyle and metabolic health. The implications of this rise extend beyond the individuals diagnosed with Alzheimer's. The emotional and economic toll on families and caregivers is profound. Dr. Perlmutter points out that the increasing prevalence of Alzheimer's is a public health crisis that demands urgent attention. Understanding the factors contributing to this rise is essential for developing effective prevention strategies. A significant portion of the conversation focuses on the role of metabolism in brain health. Dr. Perlmutter explains that metabolic dysfunction is the primary driver of many chronic diseases, including Alzheimer's. He emphasizes that the brain is particularly vulnerable to metabolic issues, as it requires a constant supply of energy to function optimally. The metabolic defects that lead to Alzheimer's often begin 20 to 30 years before clinical symptoms manifest, making early intervention crucial. Dr. Perlmutter stresses that the accumulation of beta-amyloid protein, often blamed for Alzheimer's, is not the root cause of the disease. Instead, he argues that the focus should be on improving metabolic health to support brain function. By addressing metabolic issues, individuals can potentially prevent or slow the progression of Alzheimer's and other neurodegenerative diseases. Diet plays a pivotal role in determining metabolic health, and Dr. Perlmutter highlights the dangers of consuming ultra-processed foods. He explained that these foods often contain high levels of sugar, particularly fructose, which can have detrimental effects on brain health. Fructose is metabolized differently than glucose and can lead to increased inflammation and mitochondrial dysfunction, both of which are linked to Alzheimer's. Dr. Perlmutter also discusses the importance of whole foods and a balanced diet rich in nutrients. He encourages listeners to focus on consuming foods that support metabolic health, such as vegetables, healthy fats, and lean proteins. By making conscious dietary choices, individuals can significantly reduce their risk of developing Alzheimer's and improve their overall health. The conversation takes a deeper dive into the specific effects of sugar and fructose on brain health. Dr. Perlmutter explains that while glucose is a necessary fuel for the brain, excessive sugar consumption can lead to insulin resistance and metabolic dysfunction. He points out that sugary beverages, including fruit juices, are particularly harmful, as they can cause rapid spikes in blood sugar levels. Fructose, in particular, is identified as a significant threat to metabolic health. Dr. Perlmutter notes that the body can only handle a limited amount of fructose at a time, and consuming large quantities can overwhelm the system. This overload can lead to increased uric acid levels, which further exacerbate metabolic issues. By reducing fructose intake, individuals can better support their brain health and lower their risk of Alzheimer's. Dr. Perlmutter emphasizes the critical role of sleep in maintaining brain health. He explains that inadequate sleep can lead to increased inflammation and metabolic dysfunction, both of which are risk factors for Alzheimer's. During sleep, the brain undergoes essential processes that help clear out toxins and support cognitive function. Therefore, prioritizing quality sleep is vital for long-term brain health. The neurologist also discusses the impact of sleep deprivation on decision-making and impulse control. Lack of sleep can impair cognitive function, leading to poor dietary choices and increased consumption of unhealthy foods. By ensuring adequate sleep, individuals can improve their metabolic health and reduce their risk of developing Alzheimer's. Another key topic is the protective role of exercise in brain health. Dr. Perlmutter highlights that regular physical activity is one of the most effective ways to support metabolic function and promote the growth of new brain cells. Exercise enhances blood flow to the brain, improves insulin sensitivity, and reduces inflammation, all of which contribute to better cognitive function. Dr. Perlmutter encourages listeners to incorporate movement into their daily routines, whether through structured workouts or simply staying active throughout the day. He notes that even moderate exercise can have significant benefits for brain health, making it an essential component of any preventive strategy against Alzheimer's. The discussion also touches on the gut-brain connection and its implications for Alzheimer's risk. Dr. Perlmutter explains that the gut microbiome plays a crucial role in regulating inflammation and supporting metabolic health. An imbalance in gut bacteria can lead to increased inflammation, which is linked to cognitive decline and neurodegenerative diseases. To support gut health, Dr. Perlmutter recommends consuming a diet rich in fiber, prebiotics, and probiotics. These foods can help maintain a healthy gut microbiome, which in turn supports brain health. By prioritizing gut health, individuals can enhance their overall well-being and reduce their risk of developing Alzheimer's. Dr. Perlmutter introduces the concept of continuous glucose monitors, CGMs, as a valuable tool for understanding individual metabolic health. He explains that CGMs provide real-time data on blood sugar levels, allowing users to see how their dietary choices and lifestyle habits impact their metabolism. This information can empower individuals to make more informed decisions about their health. By using a CGM, individuals can identify patterns in their blood sugar responses and adjust their diets accordingly. Dr. Perlmutter emphasizes that this personalized approach to health can lead to better outcomes and a greater understanding of one's unique metabolic needs. While Dr. Perlmutter emphasizes the importance of lifestyle changes, he also acknowledges the role of medical interventions in addressing Alzheimer's. He discusses the recent developments in medications targeting beta-amyloid accumulation in the brain. However, he cautions that these drugs should not be seen as a cure-all and that addressing metabolic health remains crucial. Dr. Perlmutter highlights the need for a comprehensive approach to Alzheimer's prevention and treatment, combining lifestyle changes with medical interventions when necessary. By addressing both aspects, individuals can optimize their chances of maintaining cognitive function and overall health. As the conversation draws to a close, Dr. Perlmutter expresses optimism about the future of Alzheimer's research. He notes that there is a growing recognition of the importance of metabolic health in preventing and treating Alzheimer's. This shift in focus could lead to more effective strategies for addressing the disease and improving outcomes for those affected. Dr. Perlmutter encourages listeners to stay informed about the latest research and developments in Alzheimer's prevention and treatment. By remaining engaged and proactive, individuals can take charge of their health and contribute to the ongoing fight against this devastating disease.